Pregnancy week 36. At 36 weeks pregnant, you are in the final month of your pregnancy, and your baby could arrive any time in the next few weeks. Your body is preparing for labor, and you may notice increased pelvic pressure, Braxton Hicks contractions, and changes in your energy levels. Your baby is nearly fully developed, practicing breathing and gaining weight. They may settle lower in your pelvis, a process called lightening. You're getting closer to meeting your little one, and your body is beautifully preparing for the journey of labor and delivery. Week 36 Pregnancy Ultrasound. At 36 weeks of pregnancy, a routine ultrasound assesses the baby's growth, position, and overall health. This examination is particularly important for confirming whether the baby is head down, which is ideal for a safe delivery. The ultrasound estimates fetal weight, examines the placement of the placenta, and monitors the baby's well-being by analyzing movements, breathing patterns, and the volume of amniotic fluid. Although the ultrasound may not detect all congenital anomalies, it can identify certain issues. Parents often glimpse their baby's face and body parts during the ultrasound, while the healthcare provider evaluates the umbilical cord and placenta to ensure proper blood flow. If the baby is in a breech position, the doctor may discuss performing an external cephalic version, ECV, to facilitate the baby's turning. If there are concerns about the baby's growth or fluid levels, additional monitoring may be necessary. A Group B streptococcus, GBS, test will be conducted to check for a common bacterium. If the test result is positive, antibiotics will be administered during labor to reduce the risk of transmission to the baby. For those expecting twins or facing high-risk conditions, a biophysical profile may be recommended to assess the well-being of the babies and consider early delivery if necessary. Week 36 Size of the baby. At 36 weeks of pregnancy, your baby is roughly the size of a romaine lettuce head. The baby measures between 18 and 19 inches from head to heel, and weighs approximately 5.8 to 6 pounds. Growth will slow down in the coming weeks to help your baby fit through the narrow passageway for delivery, and to store the energy needed for the birth. Week 36 Baby's development. At 36 weeks of pregnancy, your baby prepares for life outside the womb. Their liver and kidneys are functioning, and their circulation and immune systems are primed for action. As they mature, their skin becomes smooth and soft, and they begin to lose lanugo, the fine downy hair that covers their body for warmth and protection. The baby's sucking ability, which is important for feeding, is developing, as they will rely on breast milk or formula for nourishment in the coming months. The bones in the baby's skull remain unfused, allowing for easier passage through the birth canal during delivery. While many of their bones are still soft and flexible, they will gradually harden over time. Although most systems are nearly ready, digestion is still maturing since the baby relies on the umbilical cord for nutrition. Their digestive system will take time to develop fully after birth. Once born, their lungs will be prepared to expand as they take their first breaths, transitioning from a fluid-filled environment to breathing air. It's normal for the baby's head to appear slightly misshapen at birth, but it will normalize within a few days. As your baby's birth approaches, they are likely to move into a head-down position in preparation for delivery. If born this week, they would be classified as a moderate to late premature baby. However, the chances of severe complications are low, and they will require only closer monitoring compared to full-term infants. Week 36 Pregnancy Belly. At 36 weeks pregnant, your belly is likely at its largest and heaviest. It appears round and prominent, and you may notice it dropping lower as your baby moves into position for birth. The fundal height, the distance from your pubic bone to the top of your uterus, usually measures between 34 and 37 centimeters. As your skin stretches to accommodate your growing baby, you might experience stretch marks, itchiness, or mild discomfort. You may also feel tightness due to Braxton Hicks contractions, which cause a temporary hardening of your belly. If your baby has dropped, you might sense increased pelvic pressure. With limited space for movement, you may observe more visible shifts in your belly, such as ripples and bulges, as the baby kicks and rolls. As discomfort increases, many women encounter aches and pains, including back and pelvic pain. Using a belly band or maternity support belt can provide relief. These adjustable bands help lift the belly, improve posture, and support the back and hips, making the final weeks of pregnancy more manageable. They can also be beneficial during the postpartum period. By this stage, the uterus has completed much of its expansion and weighs about 2.5 pounds, contributing to overall discomfort. Week 36 Pregnancy Body Changes. At 36 weeks pregnant, your body is undergoing significant preparations for labor, leading to various physical and emotional changes. Many women develop a waddle due to hormonal changes that soften connective tissues, which can result in pelvic pain from added pressure. To ease this discomfort, try elevating your hips, performing pelvic exercises, taking warm baths, or getting a prenatal massage. Frequent urination is common during this stage, as the baby exerts pressure on your bladder. Some women may also experience urinary leakage when laughing, coughing, or sneezing. As your baby settles into your pelvic cavity, a phenomenon known as lightening, you may experience relief from pressure on your diaphragm, which makes breathing and eating more comfortable. While your baby continues to gain weight at about an ounce per day, you might not observe significant changes in your weight. In these final weeks, you will likely have weekly checkups with your healthcare provider, who will monitor your weight, blood pressure, and the position of your baby, looking for any signs of cervical changes. Despite any discomfort you may feel, remember that the longer your baby remains in the womb, the better it is for their health. Embracing these changes can help you prepare for the journey ahead as you navigate this stage of your pregnancy. Week 36 Pregnancy Symptoms. 1. Swollen ankles and feet. Fluid retention is common during this stage, leading to noticeable swelling in the ankles and feet. 2. Changes in vaginal discharge. You might notice an increase in vaginal discharge, which may also appear thicker or cloudier as your body prepares for labor. 3. Bloating and gas. Hormonal fluctuations can lead to digestive changes, often resulting in uncomfortable bloating and gas. 4. Headaches. Fluctuating hormones and changes in blood circulation can lead to tension and headaches during this time. 5. Change in stride. As your body adjusts to the shift in weight and your baby's position, your walking stride may alter. 6. Nesting instinct. A compelling urge to organize and prepare your home for the new arrival can kick in, driving you to clean, rearrange, and gather supplies. 7. Heartburn or indigestion. Hormonal changes and the pressure of the growing uterus can lead to persistent heartburn or indigestion, making meals a bit less enjoyable. Week 36 Pregnancy Checklist. 1. Pack your hospital bag. Gather essentials for you and your baby, including toiletries and comfortable clothing, to help you feel at ease. 2. Practice with your baby gear. Get to know your baby gear by practicing folding your stroller, adjusting your car seat, and setting up the essentials to feel prepared for use. 3. Stay on track with antenatal care. Attend your scheduled checkups and discuss any concerns with your healthcare provider for a healthy pregnancy and delivery. 4. Find a doctor for your baby. Choose a pediatrician for your newborn and schedule a consultation to ensure you're comfortable with their care approach. 5. Create a labor playlist. Create a playlist of soothing and uplifting songs for labor that can provide comfort during delivery. 6. Monitor your baby's movements. Pay attention to your baby's movements in the final stage of pregnancy. Report any changes to your healthcare provider if you have concerns. Week 36 Pregnancy Tips. 1. Skip the spiciness. Avoid spicy foods as your due date nears to prevent heartburn and digestive issues. Opt for milder options instead. 2. Eat nutritious foods. Focus on protein, healthy fats, fiber, and iron-rich foods to support your baby's growth. 3. Invest in breast pads. Whether you plan to breastfeed or not, these absorbent pads are crucial as they help prevent leaks by effectively soaking up milk, keeping you dry and comfortable. 4. Sanitary pads. Pack your preferred brand of sanitary pads for postpartum comfort, particularly those designed for heavier flow. 5. Prepare baby's wardrobe. Wash all new baby clothes and linens with gentle baby-safe detergent to keep them soft and free from harmful chemicals. For more videos like this, please like, share, and subscribe.